here at Indiana Physical Therapy with Troy Smith, one of the owners here, and we're talking about orthopedic physical therapy, which means
anything that deals with joints, soft tissue, tendons, muscles, nerves that get impinged on by bony structure, maybe a disc in the back or neck. So, yeah, any orthopedic involvement in contrast to neurological involvement like a stroke or a head injury.
So it wouldn't necessarily be like I have people who watch the show know I was on crutches for some time, had an ankle injury. It doesn't have to be an injury like that necessarily to be considered orthopedic.
No, it doesn't have to be traumatic. It can be an overuse, like a tendonitis. We do see a lot of post-operative care, whether at a knee replacement, arthroscopic procedure on the knee, shoulder, elbow. It doesn't have to be traumatic. It can be, you know, a lesser or more, basically an overuse type of
Well, and I want to talk about both situations, but let's talk about first how maybe orthopedic physical therapy could keep us from having to have that surgery or having to do something else.
Yeah. What we can do, we oftentimes will see somebody in the clinic who has generic knee pain. Maybe they're getting older. Myself, you know, I have some knee stuff going on. A physical therapist can tease out what may be causing faulty mechanics in the knee, show exercises, do manual techniques, some mobilization stuff to correct those mechanics, to ease stresses on those structures, to allow the symptoms to subside.
Sure, and then that keeps you from having to have surgery.
Quite possibly, yes.
But then if you've had that surgery, maybe you know, maybe it was a specific injury and you couldn't prohibit the surgery, then you guys come in after that and help get things back to working normally.
Yeah, we'll help restore motion, get the strength back so that normal daily function can resume.
That restoring motion is a big thing.
Big thing.
In the ankle injury, I can tell you.
Yeah, get motion, you know, controlling swelling, post-operative swelling, getting that down, and getting strength back. Yeah. Let's
talk about, we think about sometimes orthopedic physical therapy maybe in an inpatient type setting or a more intensive setting, but it really, what kind of people or what situations is it appropriate for an outpatient setting like Indiana Physical Therapy?
We see all ages from toddlers to the aged population. I think the oldest patient I've actually worked with in an outpatient setting is 97.
Wow.
So we see a wide variety of cases, demographics, individuals who have any pain or limitation that keeps them from doing what they normally do. In the vast majority of cases, high 90% will respond positively to what we do.
And it just depends on a case-by-case basis, maybe how often the physical therapy is needed, what kind of duration, right?
Yeah, we really focus on teaching patients how to care for themselves. I tell patients all the time, I give away all my secrets. Okay, I'm going to show you how to do this at home. It speeds things up. It allows for a shorter treatment duration and gets the person back functioning a lot quicker.
And you talk about functioning a lot quicker and functioning in general. I think that's important for people because sometimes when they're in a situation where there's been an injury or that pain has been around for a long time, they feel like it's never going to be the same again.
Right.
But you can make them the same, can't you?
We can get them pretty darn close. Yeah. Sometimes individuals, they have pain in certain ranges of motion, whether it's their knee, ankle, or shoulder, and so they won't go into those ranges, and the joints will get tight, and then it's just, you know, snowballs. You know, the range of motion that you're not using gets greater because of pain, and so we help them work through that. We do manual techniques, which will help restore motion so that they can do it comfortably, and then we show exercises to enhance that and reinforce that, and things just progress
Get
from
you back
there.
on the road.
Yeah, exactly. Yeah.
But let's talk about how people can get to you. They need to see their doctor and say, you know, I want to see Indiana Physical Therapy for this problem.
Yes, we see referrals from various number of referral sources, orthopedists, neurologists, neurosurgeons. Our largest number of referrals come from primary care physicians who they may see the patient with generic back pain or neck pain or shoulder pain and send them to us. We tease out what's going on, get them on a program, and get them back to action. But in the state of Indiana, you need that referral at this point in time. Yeah, we're the only state that requires that at this point in time.
All right, well, if you are in need of some physical therapy, you have some pain, or maybe you had an injury and you need help getting back on the road to recovery, visit indianapt.com so you can get all the information and get that referral from your physician today.